Hello, and thank you for your interest in Dr. Harvey Reiter's Miracle for Missing Teeth. And that miracle is, of course, the mini dental implant. It's the most exciting high-tech advancement in dentistry that he's experienced in his many years in the profession of dentistry. There are so many advantages to the mini dental implant for replacing teeth and stabilizing loose dentures that you'll want to hear every minute of this short presentation. So let's begin by briefly talking about the problem of missing teeth. Nothing is worse than the social anxiety over the cosmetic concern about missing teeth. It can absolutely be overwhelming. People with missing teeth become self-conscious and struggle to hide their smile. If you're not smiling because you're missing teeth, others may perceive you as unfriendly because you never smile. People could have a misconception about you that you're an unhappy or possibly even a mean person. Cosmetics aside, even if you are missing only one tooth, it's very unhealthy. It can cause the other teeth to move and shift. When all of the teeth are present in the mouth, they balance and stabilize each other. When one is missing, stability and balance are gone. Here the tooth above the space grows down into the area of the missing tooth, and the tooth next to the space starts tipping into that space. Your bite starts to collapse, and that change can cause more harmful grinding and clenching. Chewing functionality declines, putting abnormal stresses on your other teeth, and the harmony of a stable bite is gone. And that can lead to painful jaw joints. The bone in your jaw at the site of the missing tooth that was originally intended to hold and balance that perfect tooth starts to recede and disappear. That's right. What you don't use, you lose. And over time, the bone in that area where the tooth is missing begins to go away permanently. And if you're missing many or even all of your teeth, you might be struggling with a removable partial or a full denture that just doesn't feel natural. It flops around your mouth and is very uncomfortable, making it difficult, even painful to chew and enjoy your food. Loose dentures also make people feel very self-conscious as well. Nothing is more annoying than a loose-fitting denture. Ask someone who has one. It's a nightmare. Well, here's the good news you've been waiting for. All of these problems have been solved thanks to the miracle of the mini dental implant. And this revolutionary and life-changing technology is here now. And here's the amazing fact. Mini dental implants have been FDA approved since 1999 to replace missing teeth and to stabilize dentures. Once again, they are FDA approved, and even though they are available now, the public knows very little about them because dentistry as a profession is very slow to change and embrace new technologies and systems, even though they will greatly benefit the public. This should be a major concern because the advantages of the mini dental implant are undeniable, and it's terribly unfair that these options are not being offered to the vast majority of patients. Well, fortunately, you are learning about these proven mini dental implants right now. So here are the many, many advantages of the mini dental implant. In fact, there are so many that a growing number of dental professionals believe that mini dental implants will someday make all other dental implants completely obsolete. But you can decide that for yourself once you learn the facts. First of all, mini dental implants are less expensive because they are a simple and less complicated system using smaller sized implants that require less material to make. However, they are incredibly strong and equally as successful as any dental implant on the market. Unfortunately, the average person has found that dental implants are a tooth replacement luxury that is challenging to afford. However, mini dental implants are shattering that perception. In fact, you can save over $2,000 for a single tooth replaced by a mini dental implant. When you have such a high-quality service, like mini dental implants, available at approximately half the price of the traditional implants used by most oral surgeons, you now make tooth replacement more affordable for everyone. And that's why everyone needs to know about mini dental implants. Please help spread the word. There are really only two components in this mini dental implant system, and they are the crown and the mini dental implant. The mini dental implant fee is $1,200. All of the teeth in the mouth can be restored with a single $1,200 mini dental implant, except for molars. Since the molar is a much larger tooth, it may require two of the mini dental implants, and they only charge $400 for the second mini dental implant for a molar, making the total cost for mini dental implants for molars $1,600. But once again, for all of the other teeth in the mouth, the mini dental implant fee is $1,200. The second part of this system is the fabricated special implant crown that goes over the mini dental implant. There is a separate charge for that in the $1,200 range, and the permanent implant crown fees don't vary as much from dentist to dentist. Now here is why the traditional and much larger root form implants used by oral surgeons are so expensive. They are more complicated and have too many parts, and sometimes the more parts you have, the more problems you may have as well. But for now, we'll just look at the costs. First, you have the large implant part that goes into the bone. That's number 4 on our diagram here. Placing just that large implant segment alone will cost you $2,800 on average at the oral surgeon. You'll save $1,600 on that part alone with mini dental implants. Part number 3 on this diagram is the prefabricated abutment that is sometimes called the post. It usually costs around $600. The post abutment is attached to the implant by a screw and then tightened into place. That screw is listed on our picture here as part number 2. The bad news about those screws is that they sometimes come loose, and permanently cemented crowns on these implants become wobbly, and that can present a big problem with these traditional and more complicated larger implant systems. But not for the mini dental implants. Because the mini dental implants and crowns are a 2-part system, they don't have or even need that abutment post part. And since you don't have that part, you don't need the screw to hold it in either. So goodbye to that piece and the complications that go with it as well. The mini dental implant system has only 2 parts, so it's simpler, and simple is better. So the cost advantage of the mini dental implant is so significant because you are getting rid of the parts you don't need that only complicate the traditional larger root form oral surgeon placed implants, and you have a smaller, much less expensive implant that gives you equally successful results. So add it up and you will save well over $2,000 on a single mini dental implant versus the larger, more complicated implant that you would typically receive from the oral surgeon. Plus, they perform everything for the mini dental implants and crowns all right there in their office. So you won't have to go to 2 different places, like to the oral surgeon to get your implant and then back to the dentist for the crown. They make it easier than that because they do it all there, and that saves you lots of money, and the convenience saves you time and even more money. Another advantage is that the mini dental implant is smaller. It's very strong though because it's made out of a titanium alloy, which is actually stronger than titanium. And because they are so small, they require less surgery to place them. I think everyone would agree that generally speaking, less surgery is always preferable, and these much smaller mini dental implants allow for less surgery. There is so little surgery involved with placing these mini dental implants that it's actually closer to no surgery when you compare it to the amount of bone cutting surgery required for the larger traditional implants used by most oral surgeons. Here's the size difference between the much larger traditional dental implant placed mostly by oral surgeons and the much smaller high-tech mini dental implant that Dr. Reiter has been placing for over 7 years. Look at that giant hole that the oral surgeons need to cut out of your jawbone to place their larger traditional implants. That is some significant surgery. Now look where the mini dental implant would go into the bone and compare that tiny pilot opening to the much larger hole just to the left of it. The opening is so tiny that the implant actually compacts the bone as it is threaded in, making the existing bone denser and stronger. Less surgery with the much smaller but incredibly strong high-tech titanium alloy mini dental implant is definitely an advantage. So naturally there is far less healing time required for the mini dental implant because there is so little surgery. You saw how much smaller that hole is, so of course there is far less healing time required. In fact, when mini dental implants are placed for missing teeth, the final restorative crown is usually placed on permanently just a few weeks later, and then the entire procedure is done. Compare that to the implant placed by oral surgeons, which requires months and months of healing and further dental work before the permanent crown is placed. There's just no comparison. And when mini dental implants are placed to stabilize a denture, you can immediately use your denture following their placement. That's right. In just one visit to place mini dental implants, Dr. Reiter can create a night and day difference in the stability of your denture. They are truly miraculous. And because there is so little surgery and a very speedy healing time with these mini dental implants, it just makes sense that there is much less discomfort as well when compared to the traditional larger, more surgical implants placed by the oral surgeons. Mini dental implants are easy to place and more comfortable, and that's good news for everyone. Here's another advantage. When healing time is greatly reduced, as it is with mini dental implants, you can then replace the missing teeth and complete the dental procedures in far less time than with the larger traditional implants placed by oral surgeons that require more surgery and more healing time. This just makes common sense. In fact, With mini dental implants, you'll have your tooth replaced many months sooner, and if it's denture stabilization that is required with a snapped-in solid fit, you'll have that immediately in one appointment following the placement of mini dental implants. As you could see in a previous picture, with mini dental implants, there's such a small opening and so little surgery that it's comparatively almost like no surgery at all, and that means you have far less bone loss. More of the healthy bone is left alone and untouched compared to the amount of surgical cutting of bone that's required for the traditional larger implants placed by most oral surgeons. With mini dental implants, the healthy bone is left alone as much as possible, and patients really appreciate this. Finally, and this is a big advantage, much less bone is required in order to place the mini dental implant. So if you're lacking bone, you'll want to explore the miraculous mini dental implant advantage. Now, since the oral surgeons mostly place a larger implant, they need a larger amount of bone to make those work. If the oral surgeon feels that there isn't enough bone present, they may say that they can't do an implant at all, or they can't do an implant until they add more bone to the site with a bone graft. Well, this adds extra time and great expense. However, it may not even be necessary. One of the world's leading implant experts, Dr. Dennis Tarnow, found it odd that many oral surgeons add bone to their patient's jawbone in order to enable the fit of these large implants, when instead they could possibly be using a smaller implant that fits the available bone. When oral surgeons tell you that there isn't enough bone for an implant, or you may need a bone graft, you'll want to get a second opinion regarding a mini dental implant option, because if there isn't a lot of bone available, it just makes perfect sense to use a smaller implant in the available bone, and mini dental implants fit that logic perfectly. So you've been given 7 amazing advantages of the mini dental implant that make them the obvious preferred selection for tooth replacement as well as denture stabilization. Now here's an additional benefit of having them done at Advanced Dental. They have one of the few cone-beam 3D X-ray machines in the Las Cruces area, which enables them to do computer precision-guided surgery. This means that the implants are first positioned on the computer using the 3D X-ray to ensure proper placement and to avoid vital structures that can't be seen on a normal dental X-ray. From the computer's information, they then have a customized guide made that fits your mouth and enables them to place your implant with perfect precision. This is normally a $300 procedure, and they provide this to their implant patients at no cost. Now let's look at some real-life examples of mini dental implant miracles. Many people who are missing a tooth wear a plastic retainer that has a replacement tooth attached to it. These are sometimes called treatment partials or flippers and are usually a temporary answer. However, many people suffer with these tooth replacements for years. Here is the story of an orthopedic surgeon father who sought out mini dental implants for his son. His teenager had never developed his upper lateral incisors, and this kind of problem occurs a lot. So here he is, and he's missing his 2 teeth on either side of his front teeth right here. After he finished his orthodontic braces, this poor young man was forced to wear one of those retainer flippers with plastic teeth, replacing his missing ones. He wore this throughout his teenage years, so now just imagine how annoying that must have been. This young man's orthopedic surgeon father was determined to seek out a better, more minimally invasive way for his son with the mini dental implants, because the oral surgeons in his town had recommended bone grafting. Well, that orthopedic surgeon father wasn't buying that, and he made a 5-hour drive with his son to have a consultation to look at the mini dental implant option that would not require any bone grafting, and is great in situations where there isn't enough bone for the much larger traditional oral surgeon-placed implants. Much to the father's relief, his son was a great candidate for the mini dental implant option, and they were both relieved to avoid the surgical bone grafting. The much smaller mini dental implants worked perfectly in that area of less bone, and there was no need for the bone grafting that the oral surgeons had recommended. These implants were placed in a matter of minutes, and then they were ready for the final crowns. Crowns like this can usually be cemented on permanently in a matter of weeks following implant placement. Here they are cemented and looking perfect. 10 years later, they are functioning perfectly, looking fantastic and holding their own as well as any of his natural teeth. In fact, you can't even tell which ones are the implant teeth, but there they are on each side of those upper 2 front teeth. And this is the face of a very happy young man who was very fortunate that his orthopedic surgeon father did the research to discover this more conservative approach to tooth replacement with the mini dental implant option. This young man's father felt like a hero, and frankly, so did everyone involved. Stories like this are a regular occurrence because mini dental implants can be used for any missing tooth in the mouth, or even large numbers of teeth, which then will allow you to place permanently cemented bridges that can replace a few teeth or even an entire arch of teeth. Here's one more great example of how amazing these mini dental implants can be. This patient wears dentures to replace all the teeth. The upper denture is in place and the lower has been removed, so you can see how very little gum and bone structure there is there to secure a denture on that lower arch. Lower dentures are always much harder to get a stable fit. Anyone wearing a lower denture knows how annoying they are. They don't fit with suction like the upper ones do. Many people suffer with loose and floppy lower dentures, but they don't have to. Mini dental implants can be placed in these areas where there is very little bone under the gum to hold a denture. These implants can be placed in a single appointment, and the round balls on top of these implants can snap into housings that are permanently attached to the undersurface of the denture. So on top of this picture, you see a lower denture flipped over so you can see the undersurface and how we embed these little snap-on housing caps into the denture. The round ball heads on the implants that have been placed into the lower arch will snap into each of these housing caps and secure the denture with a solid and stable fit. Loose and floppy dentures are a thing of the past once you snap your denture onto these bone-stabilized mini dental implants. These amazing mini dental implants can be used in this way to secure upper existing dentures as well. This whole appointment takes approximately 2 hours, and you can walk in with loose, floppy dentures and walk out with the secure fit you've only dreamed about having. And once again, it can all be done in one single appointment. This is Dr. Reiter's patient Steve. He first tried a partial denture but realized that it would not work out. Dr. Reiter suggested the mini dental implant procedure. Steve was at first apprehensive but gave the mini dental implant a shot. The procedure was done with little or no discomfort. Steve can now talk to people with more confidence and eat foods with a full set of teeth. Here's another patient of Dr. Reiter's. Angel had a dental injury when he was younger after being hit with a baseball. The injury damaged the root of his tooth, leaving him with a crooked tooth that stuck in his gum. This was so annoying to him because it created a significant gap. Dr. Reiter used a mini dental implant to replace that tooth that was stuck in his gum. With little or no discomfort, Angel no longer has the gap. The mini dental implant saved the day and made a big difference for Angel's life and smile. One of Dr. Reiter's best mini dental implant stories came from David, who lost one of his teeth due to an infection. David thought he would be fine without the tooth, but found out that over time, even one missing tooth can be very uncomfortable when chewing and drinking. David visited Dr. Reiter to have a mini dental implant procedure completed where that tooth was missing. David was glad to do the procedure and was able to eat on his right side for the first time in a year and a half. Now that's a happy patient. Raimundo, like many with dentures, suffered with the hassle of dealing with a loose, floppy lower denture that never stayed in. He avoided eating certain foods because he did not want to deal with the embarrassment of his lower denture falling out. Raimundo went to Dr. Reiter for the mini dental implant procedure because other dentists charged much higher for the traditional root form implants. Raimundo received the better economical choice of mini dental implants for his lower teeth. Now, with mini dental implants, he can eat anything. Well, I've now shared with you some of the many advantages of the miraculous mini dental implants, and quite possibly the biggest one is that they are less expensive and will easily save you as much as $2,000 for a single tooth. Now, let me tell you a little bit about Dr. Harvey Reiter and encourage you to come in for a complimentary consultation to learn if mini dental implants are right for you. When Dr. Reiter decided to get trained to place the most modern high-tech dental implants of all, he studied under Dr. Todd Shatkin, the USA's #1 most experienced innovator and lecturer on the topic. Dr. Todd Shatkin's groundbreaking study on mini dental implants for long-term fixed and removable prosthetics was published in the journal Compendium of Continuing Education in Dentistry and showed that mini dental implants enjoy the same great success rates as the more expensive and much larger traditional implants placed by oral surgeons. And when it comes to high tech to bring the best science and advancements to his patients, Dr. Reiter has it all, from sedation dentistry to the latest equipment for the best and most comfortable methods to deliver implants. Dr. Reiter certainly leads the way in assuring you your best results. So thank you for taking the time to learn about this most amazing innovation in modern dentistry. Now, the next step for you is to call Advanced Dental at 575-541 888-0072 for a complimentary consultation so they can determine how the miraculous mini dental implant will work for you. They're located in the back entrance to the Mesilla Valley Mall. They look forward to providing you with the revolutionary benefits of mini dental implant dentistry. Once again, this unique modern dentistry approach offers new opportunities for individuals who've lost one or more teeth. Even for those who've lost all of their teeth, mini dental implants offer a second chance at teeth that look, feel, and function more like the teeth they were born with. And all of the team at Advanced Dental of Las Cruces look forward to meeting you and helping you achieve your best health and happiness with a great-looking smile. And all that can be yours with mini dental implants.